Imagine finding out that the thing stealing your memory was never age. It was never just getting older. It was never stress. It was never bad luck. It was never some mysterious curse that appeared out of nowhere one morning and slowly took pieces of you away. It was sitting in your medicine cabinet the whole time. A bottle with your name on it. A pill you trusted. A pill you took because you were trying to protect your health. Trying to sleep. Trying to stay calm. Trying to control your bladder. Trying to stop pain. Trying to lower your cholesterol. Trying to do exactly what your doctor told you to do. And while you were trusting it, it may have been quietly changing the way your brain works, slowing it, fogging it, weakening memory, flattening emotion, blunting alertness, making you less mentally quick, less steady, less sharp, less like yourself, until one day the people who love you start saying the words almost every older adult fears hearing. He's just not as sharp as he used to be. She keeps forgetting things. He seems different. She's here, but she's not really herself anymore. And here is the part that should terrify every family watching this. Sometimes they are right to be afraid, but sometimes what they are calling dementia is not dementia at all. Sometimes it is chemical, sometimes it is medication, sometimes it is a pattern that built slowly, silently, day after day, refill after refill, while everyone kept blaming age. I'm Dr. Adrian, and I need to tell you something every senior, every spouse, every son, every daughter, and every caregiver deserves to hear clearly. Some medications can absolutely damage memory, attention, processing speed, balance, mood, and mental sharpness in older adults. Not because every prescription is bad, not because every doctor is careless, not because medicine is the enemy, but because the aging brain is not the same brain that tolerated those same kinds of drugs 20 or 30 years ago. It is more sensitive, more vulnerable, more easily sedated, more easily confused, more easily pushed off balance. And once a person reaches their 60s, 70s, or 80s, a medication that once felt harmless can begin creating a pattern that looks exactly like the early stages of dementia. That is what makes this conversation so serious. Because families usually do not see a pill problem. They see a person changing. They see slower thinking, poorer memory, more brain fog, more falls, a flatter personality, a shorter temper, more confusion, less energy, less spark. And because those changes often happen gradually, they assume the brain is naturally failing. Sometimes it is. But sometimes the brain is being drugged, quietly, repeatedly, every single day. That is why I need you to stay with me until the very end of this. Because I'm going to walk you through 9 of the most dangerous medication categories linked to memory decline in older adults. And the most dangerous one on this list is not a single pill. It is a silent pattern, a pattern that can make an aging brain look like it is disappearing. And if no one catches it in time, the damage can keep building while everybody keeps telling themselves it is just old age. Before we begin, let me say one thing with absolute clarity. Do not stop prescription medication suddenly on your own because of this video. Some need tapering. Some may still be necessary. Some may need safer substitutes. Some may need dose adjustments rather than immediate discontinuation. This is not about panic. This is about awareness, about asking better questions, about protecting the brain before more damage is done. And I want to tell you something else before we start the list. One of the biggest tragedies in older adults is that medication-related cognitive decline often gets discovered too late. Why? Because it usually does not look dramatic in the beginning. The person does not collapse overnight. They drift. They become a little slower, a little foggier, a little less organized, a little more forgetful, a little less emotionally alive, a little more hesitant, a little more easily overwhelmed. And because it is not dramatic at first, nobody thinks to ask the question that should be asked immediately. What changed? What was added? What started 6 months ago? What started a year ago? What was doubled? What was added for sleep? What was added for bladder symptoms? What was added for anxiety? What pill has been taken every day since the trouble began? That question can save years of suffering. Now let's begin with number 9. Diphenhydramine. Most people do not know the formal name. They know the packaging. PM sleep aid, nighttime cold medicine, nighttime allergy relief, a familiar pill from the drugstore, a bottle in the bathroom cabinet, a little helper people trust far too easily. That familiarity is exactly what makes it dangerous. Because older adults often do not think of over-the-counter medications as serious medications. They think of them as casual, temporary, mild, too ordinary to be a threat. But diphenhydramine carries a strong anticholinergic burden. That word matters, anticholinergic, because it means the drug blocks acetylcholine. And acetylcholine is one of the most important chemical messengers your brain uses for memory formation, learning, attention, and alertness. If you want to understand why these drugs matter so much in seniors, start there. The older brain depends heavily on preserving what acetylcholine function it still has. The younger brain has more reserve, the older brain has less. So when an older adult repeatedly takes a drug that blocks acetylcholine, the result is not just sleepiness. The result may be grogginess, confusion, slowed thinking, Poor new memory formation, weaker concentration, worse balance, and the kind of next-day brain fog that people often blame on poor sleep instead of the medication they used to create the sleep. And that is the trap. They take it because they want rest. Then they wake up mentally duller, slower, heavier, less clear. And nobody blames the pill because the pill never looked dangerous in the first place. I once spoke with a woman whose husband kept saying, "I think I'm getting old overnight." That was his phrase, getting old overnight. What had really changed was not his age. It was that he had started taking a nighttime over-the-counter sleep aid almost every evening. Within a few months, he was groggy in the morning, more forgetful during the day, and increasingly unsteady when getting up from bed. The family feared dementia. What they were really seeing was medication effect layered on top of an aging brain. That is why this matters so much. Over-the-counter does not mean safe for the aging brain. Now, number 8. Proton pump inhibitors. Medications like omeprazole and esomeprazole, some of the most commonly used drugs in older adults. Heartburn, reflux, GERD. These drugs seem digestive, not neurological. That is why families rarely suspect them when the brain starts changing. But long-term use can interfere with the absorption of nutrients the brain depends on, especially vitamin B12 and magnesium. And once those deficiencies develop slowly over time, the effects may begin showing up in exactly the ways families fear most. More forgetfulness, more brain fog, less energy, poorer concentration, mood changes, lower mental resilience, reduced mental sharpness. The problem is rarely dramatic in the beginning. The problem is slow erosion. The medication stays on the list for years. Nobody revisits it. Nobody asks whether it is still necessary. Nobody asks whether the dose is too high. Nobody asks whether the person still needs daily treatment or whether a safer strategy might work. And because the original symptom was heartburn, all the attention stays on the stomach while the brain quietly starts paying part of the price. This is one of the most common patterns in medicine. A drug started for a good reason becomes permanent by inertia, and what becomes routine stops being questioned. I knew an older man who had been taking one of these medications so long he forgot why it was started. His daughter noticed that he had become flatter, more tired, and mentally slower over the previous year. Everyone blamed aging. When his full situation was reviewed, he had significant nutrient depletion, long-term medication burden, and several symptoms no one had ever linked back to the drug because it had become part of the furniture of life. That is what routine can do. It can hide the cause in plain sight. Now, number 7. Bladder control medications. Especially strong anticholinergic ones like oxybutynin. This one gets missed constantly, and one reason it gets missed is because the symptom it treats is so personal. Urgency, leakage, frequent bathroom trips, embarrassment, interrupted sleep, loss of confidence. Seniors are often so relieved to have help that nobody wants to question the medication. Families feel relieved too. A humiliating problem now seems controlled, so the pill stays. But many bladder medications work by blocking acetylcholine, and now you know why that matters. Memory depends on it, attention depends on it, mental sharpness depends on it, so now you have an older adult taking a pill for the bladder that may also be quietly dulling the brain. The person becomes more forgetful, more mentally slow, more easily overwhelmed, more foggy, less sharp in conversation, less confident. And the family says, maybe this is just age. That is exactly how medication-related cognitive decline hides. It arrives wearing the mask of normal aging. I remember a daughter telling me that her mother had become less mentally present after getting help for bladder urgency. That was her phrase, less mentally present. She was relieved the bathroom trips had improved, but she could not understand why her mother had become more forgetful, more mentally tired, and less like herself. No one had explained that the medication helping one part of daily life might quietly be injuring another. That is why these drugs deserve careful review in older adults. Not fear, review. Now, number 6. Statins. This one needs nuance, because statins are not simple villains. For some people, they are important. For some, they are beneficial. For some, they are absolutely the right choice. But they are also one of the most commonly reported medication categories when older adults begin describing new brain fog, slower thinking, reduced mental sharpness, or a strange feeling that they are not as clear as they used to be. Why would that happen? Because cholesterol is not just something floating in the blood waiting to clog an artery. The brain depends on complex lipid structures. Nerve cells depend on stable membranes. The brain is rich in fat. Its communication systems depend on structural integrity. So in some older adults, especially at higher doses or with certain statins, aggressive cholesterol lowering may be associated with cognitive complaints. Not in everyone, but in enough people that it should never be dismissed automatically. I have heard the descriptions so many times they start sounding almost identical. I can't find words as quickly. I feel dull. My thinking feels slower. I can't keep up with conversation the way I used to. I'm not confused exactly, I'm just not as clear. That does not prove the statin is always the cause, but it proves something important. If the cognitive change began after a medication was started or intensified, that timing matters. And timing deserves a real discussion, not an automatic dismissal. One older gentleman told me that after a dose increase, he still functioned, still drove, still handled most of life, but everything took more effort upstairs. That phrase matters. Everything took more effort upstairs. That is how many seniors describe mild medication-related cognitive burden long before anyone labels it. Now number 5. Benzodiazepines. Drugs like lorazepam, diazepam, alprazolam, and similar medications used for anxiety and sleep. At first, they often feel like relief. The nervous system quiets down, the racing mind slows, sleep comes more easily, the person feels calmer. That is exactly why they become so difficult to question. But calm can become sedation. And sedation in an older adult is not a small issue. It can mean slower thinking, poorer memory, reduced reaction time, more falls, less emotional vitality, more disconnection, more confusion. Families often describe it in painful, almost grieving language. He's there, but he's not really there. She used to be lively. Now she just seems dulled. He doesn't feel like himself anymore. And the cruel part is that the medication can begin to feel essential while it is quietly becoming part of the problem. Then if someone tries to stop it suddenly, withdrawal can be miserable or even dangerous. That is how the trap tightens. A drug given for calm slowly steals clarity, then makes itself hard to leave. This is why long-term benzodiazepine use in older adults deserves extreme caution. Not because no one should ever receive one. Because older brains pay a higher price for prolonged sedation than most people realize. I have seen families mistake this sedation for personality change. They do not say, the medication is too strong. They say, he's lost his spirit. That is how deep the effect can feel when a sedating drug slowly takes a bright, responsive brain and wraps it in fog. Now number 4, amitriptyline and similar older medications with strong anticholinergic effects. This is one of those drugs that keeps showing up in older adults for multiple reasons. Pain, sleep, migraines, mood, nerve discomfort. That flexibility is exactly what helps it remain on medication lists for years. But it carries a heavy anticholinergic burden, and that means it can do exactly what you now know to watch for. Fog the brain, slow memory, reduce concentration, make thinking feel heavy, make the person less mentally resilient than they were before. And because the change is often gradual, families do not always connect it to the medication. They just see a person becoming less mentally clear over time. I remember hearing a spouse say, he can still remember old stories, but everyday thinking now feels like work for him. That is what these drugs can do. They do not always wipe out identity all at once. Sometimes they just make the mind feel effortful, heavy, blunt, slow. This is why medication conversations must always include a brain question. Not just, does it help the symptom, but what is it costing cognition? That question alone can prevent a tremendous amount of harm. Now number 3, paroxetine. Many people hear SSRI and assume the conversation ends there. Modern antidepressant, routine. Safer than older psychiatric drugs. Probably fine. But paroxetine is different from many others in its class because it has meaningful anticholinergic properties. And for older adults, that matters a lot. Because now, you have a medication prescribed for mood or anxiety that may also be quietly interfering with the very brain systems responsible for memory and clarity. The person may become more forgetful, more mentally dulled, less quick, less themselves. And because the drug was given for emotional support, the family may blame depression when the real picture is more complicated. This is why paroxetine should never be prescribed casually in an older adult without serious thought. There may still be situations where it is used, but there should always be a reason strong enough to justify the cognitive risk. Now number 2, antipsychotics. This is where the emotional cost becomes especially painful because families often do not even realize what has been given. An older adult becomes agitated, restless, confused, hard to manage, and instead of deeply asking why, someone reaches for a powerful sedating psychiatric medication, sometimes in a hospital, sometimes in a care home, sometimes in a nursing facility, and then the person starts changing, not subtly. They become flatter, slower, less expressive, less present, less emotionally alive. Families describe it in words that stay with you. It's like the light went out. That sentence is devastating because it is often true. These are major brain-active drugs. They can increase stroke risk, worsen sedation, increase falls, deepen cognitive decline. And they are sometimes used because they make someone easier to manage, not because they are the only medically ethical option. That is why families have to ask hard questions. Why is this necessary? What symptom is it treating? Is it the lowest dose possible? How long is the plan? What is the exit strategy? If no one can answer those questions clearly, the situation deserves much more scrutiny. I have watched families sit beside a loved one and grieve a personality that vanished in days. Not because a disease suddenly surged, but because a powerful medication flattened everything that made the person feel recognizably present. That kind of loss is real, and families need language for it. And now we come to number 1. The most dangerous pattern on this list, not one drug, many, anticholinergic polypharmacy. This is the hidden threat most families never hear about until the damage is already obvious. Because one medication with anticholinergic burden may do some harm. 2 may do more. 3 or 4 can create an entirely different level of brain stress, and this happens quietly. One doctor adds a sleep aid, another adds a bladder medication, another adds something for pain. Something else comes from the pharmacy shelf, a nighttime allergy pill, a PM product, an older antidepressant. Each one alone sounds manageable. Together, they create a cumulative burden the aging brain may not be able to withstand. That is when the person begins to change in a way that terrifies everyone. More confusion, more memory problems, more falls, more fog, more emotional flattening, more difficulty functioning. And the family thinks they are watching dementia unfold. Sometimes they are. But sometimes they are watching an overwhelmed brain drowning in medication burden. That is why this number 1 risk matters more than any single pill on this list. Because polypharmacy does not arrive dramatically, it arrives administratively, quietly, one refill at a time, one symptom at a time, one prescriber at a time, until no one is looking at the whole picture anymore, and the brain starts paying the bill. This is the part I wish every family understood sooner. Sometimes the most dangerous medication is not a medication. It is a medication list. That is where the true danger lives. In the accumulation, in the overlap, in the sedating load, in the anticholinergic burden, in the way 5 reasonable drugs together can do what one alone might never have done. I have seen older adults regain clarity after careful deprescribing. Not every case, not every symptom, not every patient, but enough. Enough to know that this conversation is not just about fear. It is about opportunity. Because some medication-related cognitive decline is partly reversible, sometimes meaningfully reversible, but only if someone catches it early enough and asks the right question before the pattern hardens into years of preventable damage. So what should you do now? First, do not panic. Second, do not stop medications suddenly on your own. Third, make a full list, every prescription, every over-the-counter product, every sleep aid, every allergy pill, every PM medicine, every bladder pill, every supplement, everything. Then take that full list to a doctor or pharmacist and ask for a real medication review. Not just whether each drug makes sense on its own, whether the total burden is hurting the brain. That is the question. Not is this one pill okay, but what is this whole medication pattern doing to memory, clarity, balance, and mental function? That is where lives change. Because once you see the pattern, you can begin changing the pattern. And that may be one of the most important things a senior or caregiver ever does. Let me leave you with this. The aging brain is vulnerable, but it is not helpless. And sometimes what looks like decline is not simply age, not simply bad luck, not even simply dementia. Sometimes it is chemistry. Sometimes it is cumulative. Sometimes it is sitting right there in the medicine cabinet, waiting to be questioned for the first time in years. So remember this. The most dangerous medication problem is not always the most dramatic one. Sometimes it is the quiet daily accumulation of drugs that slowly block memory, dull alertness, flatten emotion, and make a living mind look like it is slipping away. Do not let routine fool you. Routine can still be dangerous. And when it comes to the aging brain, one honest medication review may protect far more than memory. It may protect the person themselves.